This is Popping the Bubble with hosts Sandra Ponce de Leon and Pete A. Turner.
This is Basil Harris from Basil Leaf Technologies, and you're listening to Pop in the Bubble.
All right, Dr. Basil Harris, our special guest today, is a physician with a PhD in engineering. Show off. He's been actively practicing emergency medicine for more than 12 years at Lankenau Medical Center in Philadelphia. Basil Leaf Technologies was started in 2012 to develop interactive consumer-level products that empower individuals to monitor and improve their personal health. Basil Leaf Technologies' team, Final Frontier Medical Devices, is led by Dr. Harris and his brother George Harris, a network engineer. Their extensive individual accomplishments over the past 20 years combined to bridge the fields of medicine and technology by tapping their experience in medicine, surgery, programming, signal processing, hardware and process design, medical sensors, user experience, health policy, and mobile technology. The team created this year's winning prize, Dexter, a tricorder prototype for the QUALCOMM Tricorder XPrize Competition. Dexter is a consumer product designed to monitor your health and diagnose illnesses in the comfort of your own home. Dexter operates autonomously, but can also share important information with your healthcare providers at your discretion. At the heart of Dexter is an artificially intelligent engine that learned to diagnose by integrating years of experience in clinical emergency medicine with data analysis from actual patients having a variety of medical conditions and outcomes. Included within Dexter is a collection of non-invasive sensors designed to collect data about your vital signs, your body chemistry, and biological functions. The diagnostic engine synthesizes your health data to make quick and accurate assessments. Wow.
Holy cow.
How'd you come up with that?
Before we go any further, let me also say this. You're on Popping the Bubble. This is not Sandra sitting next to me co-hosting. This is my co-host from the Break It Down show, John, who's guest hosting while we're in LA at the XPrize headquarters.
Yeah, excited to be here.
Yeah, the day after they awarded you this prize. And all those words you just said, I have to slow down and breathe for a minute.
Well, if we can sum it all up, is it fair to say that you've integrated all of those technologies to make a device that allows for medical diagnosis based on a wide variety of knowledge? And that is an enormous advance in medical technology.
And you brought science fiction to life.
It's incredible. We're so proud of participating in this QUALCOMM Tricorder XPrize and bringing this thing into reality. This was a demonstration product. The whole contest was really to show, to highlight, what is capable, what is possible. Taking a diagnostic device and putting it in the hands of a consumer that can get information at the time they need it the most is really the goal. All the tricorders that were in the finalist group really are to show, what the breadth and the depth of the different diagnoses we could cover, from acute illnesses to chronic diseases, infectious diseases, things that are, simple to diagnose, to things that are more complicated. So this being put into the hands of actual users when they're at home, to get real medical information and to understand their conditions is going to start changing the world.
Boy, no kidding.
Yeah, I mean, as we imagine it, if someone with, who knows, a variety of maladies has access to all of the information within themselves, can censor all of that information, and then kind of bump that up against all of the medical information that exists in the database, which I'm sure you're constantly feeding. What's missing? In other words, if you're taking a physician's diagnosis, I don't want to say out of the equation, but at least providing a preliminary diagnosis that allows a person to make some decisions about how to proceed. How does that affect the decision-making process? Should we, as consumers, have that decision to make at that time?
This provides a consumer with information. So this doesn't take the doctor completely out of the equation. This is not to replace your doctor, not to replace physicians. This is to help make their job more efficient. So you, as a consumer with a condition, you can get the information when you need it. You can get a real medical diagnosis, real advice, and transmit that to your physician. And it gives you an idea. Do I need to go to a primary doctor or an urgent care or to the emergency department right away? And the goal, my dream for the future as working as an ER doc is to have a patient come in, and bring their tricorder readout and say, hey, I have a tricorder at home. This is my stream of vital signs, my lab tests, my diagnosis tells me I have pneumonia, told me to come here. And maybe I already have that stream of information transmitted to me, and I want to be able to trust that information and go to the next step.
Wow. So let's say in that particular situation, if we can just kind of multiply that out to give us an idea of the scope of what you've done. I go into the ER and I say, exactly as you said, I have pneumonia according to my tricorder. How much time did we save?
You saved a ton of time and a ton of money for, the average time it takes for a person to get a visit with their primary care doctor, assuming that they even have one, can be several weeks.
Sure. But let's assume the case that we just did where I have pneumonia. So if I walk into the ER knowing a diagnosis with a basis in fact and all the information gathered, how much time did I save figuring out that I have pneumonia? I mean, are we measuring that time in hours, several hours? How much time does it take? It's days. So how many lives get to be prolonged because I knew about my pneumonia days sooner?
This technology, whether it's the device that we've made, the devices that are going to be coming out on the market, this technology is coming. And it's going to affect billions of people, because not just in the U.S., here where we talked about how to increase in efficiency, where we already have excellent healthcare with obviously many barriers for healthcare. I work at an emergency department where 40% of my patients may not have access.
Yeah, access is our problem.
Access is a problem. But in the developing world, you have billions of people that have zero access.
Right. Yeah. So the push-pull effect of what your device is, and maybe it's not quite there yet. Let me know if it is or not. But the hospital could also receive constant uploads from people. Sure. Like if you've got a kid that's got diabetes or, lupus or something that requires, constant attention, the hospital can be like, oh my goodness, this reading is high on your kid.
Let's ring an alarm.
Let's bring it in,
Absolutely. Yeah. I mean, to help manage chronic diseases, right. Diabetes, COPD, asthma.
Sure. Yeah.
Congestive heart failure. These are conditions that I see patients over and over again when their condition gets out of hand.
Right.
If we can get a hold of them destabilizing while they're still relatively well and make smaller corrections, keep them out of the hospital, keep them healthier. So that's a big focus of what this type of technology can do.
What it can do, I'm going to interject because we're talking about, let's say, maybe the upper middle class of healthcare in this scenario. If we ratchet it back just a little bit, I want to give you a very practical example. Last Tuesday, I called Pete about 9:30 in the morning and I said, hey, Pete, I got to talk to you about these shows we got coming up. And he said these words to me: I'm headed into the VA. And my response to that was, I'll talk to you tomorrow. So really, you would have just saved me 24 hours. And I wasn't even the one being treated.
Yeah. Yeah. And I was going to use a real world example too. My dad passed away from pneumonia in January, and I know a number. Yeah. I mean, it's tragic and everything. And he sucked at fighting infections. So once that came along, but if he would have made it 2 more years, maybe he could have had a try, because he's not a healthy guy, but he's also 69. He's not that old. So if he knows that he's not good at infections, and I'm assuming the tricorder finds infections possibly. Yeah. Okay. Yeah. So now he gets to say, oh, I don't just have a cold, or, maybe even a flu, or maybe about the flu earlier. You can go in and get help earlier. Like if I'm sick, I don't even bother going to the doctor. I'm like, this is going to pass, or I'm going to get really sick.
Right. Well, this is the type of device that you could have when you're not feeling well to help you make that differentiation.
Sure.
Okay?
Yeah. Because otherwise, by the time I find out I got the flu, I'm done with the flu.
Right.
Huh.
To help you make a decision. Is this something that's just going to blow over in a couple days, or is it something that I really need to take action on?
Wow. What do you think separated Dexter from the other entrants in, the other devices in the running?
Okay. Well, I think we approached the problem probably completely differently from the other teams. I stuck with what I knew. Now, I'm an ER doctor. I make diagnoses all day long. People come in with their symptoms. I look at their signs. I look at their vital signs. We get the appropriate tests order. I see the results. I make a diagnosis. That's just what I do. And so that's how we approach the problem. Pretty simplistically, we just decoded the actions of making a diagnosis and made artificial intelligent routines for that. And then we thought about the sensors afterwards. How do we get the actual data, the objective information came secondary.
Wow.
And I think most other teams, they looked at a cool sensor first and then tried to figure out what to do with that information.
Are you saying that, so as an ER doc, this is what I see? I see these kind of situations come in. What are the things that indicate that's happening? And build your sensor off of those things? In fact, what tool would you build for yourself? Is that what you're saying?
Pretty much.
Wow.
What information do I want when I'm making a diagnosis?
Sure.
If I see a patient that comes in that may have pneumonia, what do I need to know to either make that diagnosis or to be reassured that they don't have it? And so those are the tools that we then built. So we always say we're looking for smart data, not big data.
Right. Yeah.
Well, and here's the other thing. I'll speak for Dr. Harris here and say that your background in engineering helped you to understand, if I'm to get that data, what's the best way to collect it and then deliver it, prioritize it, deliver it, and then a plug for your brother George, who said, I'm going to figure out how to reach out into the knowledge base of the hive mind, if you will, and collect all of the data that's coming in real time from, I'm just riffing here, but man, you're not only developing a technology that's solving a problem, you're developing a technology that's getting great minds in the world to say, wait a minute, if we're halfway there, let's help take it the rest of the way, right? Let's gather the data. Let's put it all together. Let's make these diagnoses based on comprehensive data around the world. And if it's maybe around the world, that's one thing. But you can also say, well, this particular problem, though, is spiking on a local level. So let's see what's local.
Right. It can be interactive. It could be a smart system that knows, hey, in this area, we have a flu epidemic. Mm-hmm. In this area of the world, we have a Zika epidemic.
Wow.
And it can help differentiate, people interacting with a system with the same stream of vital signs, depending on where they are and what they've been exposed to. It might indicate what tests need to be done.
Wow.
In something like this, as you get out to that big data, that global data, that multi-million nodal system of all these things, someone like an organization like WHO can rapid deploy doctors to a given area or just better manage where these people are, because everybody needs help. But if you're able to localize that help to the greatest impact, in theory, you might get more efficiency of care, or just know that we can send 4 doctors here because of what we're getting.
It's a great point, because we spoke a little bit about, what does it do for people in the developed world, right, where we have huge technological, huge hospitals, but lack of access.
Right.
What can it do in the developing world, where they have billions of people that have zero access to any medical care,
right,
but also in crisis zones,
sure,
like refugee camps in Syria.
Yeah.
And how do you deploy into the camps, into the field, into the front line, mm-hmm, where you need to have information?
Right.
And you might not be able to mobilize a team of physicians that fast, but you could send a healthcare strike team, with an army of tricorders, out into the camps to gather real data, real information, and then feed that back to the physicians that are just interpreting it.
Yeah,
from
you might even be able to
get.
Well, you absolutely can get to the point where you're left of the crisis,
mm-hmm,
whatever's coming,
identifying spikes, and isolating a crisis, understanding that there's something coming and that you can respond. Right. Maybe not mobilize a big team sooner, but maybe not mobilize a big team, but mobilize a small team sooner.
Yeah. And maybe it's only as accurate as earthquake warnings, but this is earthquake weather right now. Let's all be ready. And maybe even that element will create enough awareness that there's some more prevention that happens. Or
How'd you get earthquake weather out of this? Are you reading like Grandma's Corn? Where she's like, my bunion hurts. Whenever my bunion hurts,
it must be the earthquake weather. Yeah.
There might be something to that. We got to study that.
Yeah. Yeah.
Okay.
Corns to earthquake.
Just making a note. We're going to study the bunions. Okay.
So we know we can aggregate all this data and everything else. Talk to me about the practical use of Dexter. I mean, obviously it's going to cost something. And how often am I checking in on my Dexter unit? Am I attaching it to my face? What am I doing?
Who gets it first?
Yeah, there you go.
Who gets it first?
Yeah.
We have to go through some rigorous trials to get FDA clearance, to get this out there. And who gets it first is there's going to be so many different incarnations of this type of tech. So it's going to be the consumer, in an urban center. It's going to be on the front line in a developing world. These studies that are getting underway now, that's who's getting it first.
Yeah.
So.
Wow. Well, I tell you, if you give one to my grandma and she can predict earthquakes, I think we have a winner.
So how does it work, though? I mean, when you have it in your home, are you doing a daily examination? Is that too often? Is that too expensive to do?
The price of doing an exam is minimal. Okay. I mean, so we don't, these prototypes, these units cost a lot to make.
Sure.
But our target price point is around $200.
Right.
And you would marry that with your own smartphone or your own tablet to be the brains of it. Mm-hmm. And then the sensors would come along and pair with that.
Yeah, because you have the sensors, you have the data gathering brain, and then you have the communication piece, and it can feed it to your phone or your tablet, and that'll be the communication piece.
Yeah, absolutely.
So right now, if you're talking about entering the market at a $200 price point, that to me sounds amazing, because we in this room can envision that $200 price point, and we know what happens to technology, right? It just gets cheaper. So as we continue to make advances and make it cheaper, it spreads out.
Is there a subscription-based revenue path as well?
I don't think we've gotten that far yet to think about that. Well, this is a great. They're good questions.
I think Pete just made you a lot of money.
Yeah. Okay. So
you're going to be referred to in meetings. So we're talking about revenue path. We're going with plan A, which is the Pete path. Right?
$5.
And then there's somebody in the back of the room going, who in the hell is Pete?
Yeah. $19.99 is the platinum package. You guys say it's non-invasive. You get to say that. I don't know what that means. Does that mean I have to jab a needle into my arm? Because that's considered non-invasive. How does this thing?
How invasive is invasive?
Yeah, that's exactly it. Yeah.
Well, I think that's it'll vary, that definition, for each individual.
Yeah.
But, for what Pete, they consider non-invasive.
Really low bar, just so everybody knows.
Yeah, but we aim to not draw blood. But as you go through the system, depending on what the system is interpreting, your signs, your symptoms, you might need to give a urine specimen.
Yeah.
You might need to do a little finger stick for a drop of blood, but no big needles in the arm.
Wow.
So
that's terrific.
Oh, I was bevel up. I was ready to go.
Just
jam that thing in there.
Well, the good news is you do get to give a urine sample.
That's true. I peed on my phone.
Yeah. Oh, was it not time for that yet?
How am I feeling?
Wow. Guess I'm going to have to replace this screen. So, what's next now that you've won the prize?
Can I say this about the prize too? You guys won basically the grand prize. I mean, a lot of your competitors also won. It's just you won the biggest, toppest, most bestest prize, and everybody else won money, because the innovation that comes out of what XPrize does is there's multiple innovations that go in 360 degrees in directions. I mean, maybe the guy who came in second place has just invented something even more incredible. We just have to wait 6 more months for him to go that way.
That's the beauty of XPrize and these contests. All of the finalists are winners,
right?
And then all of us as consumers are winners, because all of these tricorders have their unique aspects to them.
Sure.
And in the future, there's going to be multiple tricorders out there for us to choose from.
Right.
The ultimate tricorder is going to be a combination of all of them.
Yeah.
We're going to push ours forward. What happens now is really the exciting part, because this is just the beginning.
Sure.
And now we're taking this technology, getting through our FDA trials, getting it approved, and getting it out there. And it's you mentioned how things just keep getting cheaper and smaller and better. And we're going to expand the diagnosis set, and that's going to be it's the revolution in healthcare.
If the award ceremony was going to be on April 12th, 2018, what would you have added in that year?
Well, just from last year to this year, we've added a lot of sensors, reliability. in our sensors. So we're already on to our next generation sensor from what we delivered, 6-8 months ago to XPrize.
Right.
So I don't know the future.
Yeah, but it gets better.
It gets better.
Wow.
Yeah, that's incredible.
I think next we're going to have to attack how to make more food.
Yeah. Yeah, really. Okay, so we've got this relatively non-invasive sensor that is going to look at and say, hey, Pete, you've got lupus. That's been my example. I like the word pleurisy and lupus when I talk about medical things because they're funny words to say. Terrible diseases, funny words to say.
Chlamydia is not a flower. Sorry.
So when I'm using this thing, like how wide is the diagnosis base? I don't even know if I'm using the right terms, but the array of things you can test for.
Sure.
What falls within that?
Yeah. So from, when someone comes into my ER, the diagnosis base is endless.
Right.
Yes. The device is focused. Right now the demonstration device is for this competition.
Right.
The diagnosis set was 13 conditions.
Wow.
Okay. We have our device programmed for 34 conditions. And I think by the time this thing gets to market, it'll be well over 100.
Wow.
And that's a core set of conditions.
Yeah.
But that doesn't, it sounds like a lot, but it doesn't encompass everything.
Sure.
Just the majority.
No, but it does get you past 100. And if most of what is that? If we took that 100 and made it a percentage of maladies that I might walk into the ER with, how much of what you see every day, just on a day-by-day basis, it falls within that first 100?
Sure.
Quite a bit, right?
It's the vast majority of things are going to be common. Vast majority of cases that come in, you have a certain set of symptoms, you have a certain set of signs, you have laboratory tests. Common things happen commonly.
Yeah.
Right.
So we're not picking out the zebras.
Yeah.
Right. So then you have that one instance where there's the flashing bovine, and that's the holy cow button.
Yes.
Which means you're outside of the 100. Get to the ER fast, right? And that is the next first step.
Next first step.
Yeah.
I don't know if you've got a sensor in there for a snapped Achilles tendon, but I'll give it to you for free right now. If you say these words to yourself, listener, it feels like someone kicked me in the back of my leg and my foot's kind of weird. You snapped your Achilles tendon. Done. 35.
Awesome.
Yep. I'm here to help.
There we go. Well, congratulations. I think we want to absolutely congratulate you. We want to tip our cap and say that it's an honor to be in the presence and have on our show a technologist and a medical practitioner who ties it all together and advances the science to help us all live longer, more fulfilling lives. Thanks.
Awesome.
Yeah, man,
Thank you.
really fantastic. I do want to ask you one more quick question. I know you got to catch an airplane, so it will be fast. What jobs is this going to winnow down, do you think? And then let's also say that with the understanding, Matt Greeley's an innovator. He's got a company called Bright Idea, and he talks about the pace of innovation. As long as it exceeds the pace of automation, we're fine. Plenty of jobs, plenty of things to worry about. So the innovation will create new jobs. What are we going to see less of, though? When to try 10 years from now, when the tricorder is out and it's established, who's going to have less work?
I don't think this is going to take any jobs away.
Wow.
We already have a shortage in physicians, in medical care. Mm-hmm. If this can help make, as physicians, our lives a little more efficient,
sure,
we already need more.
Right.
And then it's going to add jobs. We need people to build tricorders.
Of course. Yeah. Build tricorders, develop new apps for tricorders.
Make them smaller.
Yeah. Push it to 38 or whatever. Yeah, absolutely.
Make more things that Pete can provide a urine sample to. That's a full-time job.
It is. It is.
So, but again, thank you. We hope you catch your plane.
Thank you. So do I.
And we'd love to do a follow-up at some point.
Please.
So when you're back in town, you're based in Philadelphia?
That's right.
Okay, we're going to try to make it out to Philadelphia at some point.
There's a guy who makes a pig on a stick out there.
Yeah.
And it's just fantastic.
That's true.
So
that's true.
Yeah. I'm not even joking. Like this guy he has a Cuban place and it's ridiculously good. So a whole summer long, he takes up a parking spot. No one gets mad because there's a pig out there just turning. So
we're going to talk about a guy who needs some non-invasive.
Yeah.
What is that word?
Invasive?
Non-invasive sensors. Yeah. Man, I blew my joke because I couldn't pronounce non-invasive.
Oh, I need a Cuban sandwich. That's what I need.
Okay. Yeah. Anyway, so Dr. Basil Harris, thank you very much.
Thank you, guys.
Thank you.